When we talk about participants at SAM, we are dealing with people who may be living with a mental health condition and or unemployed or working less than 16 hours a week. And people may sort of shift across those different categories. So we're all about giving people a voice, and that's so important to us because when people come to us, their confidence may be low, either because of the nature of the condition they're living with or because of their employment situation. So for us, it's all about people feeling empowered from the start. So when they come to us, we meet with them, we talk about what the project can offer, we offer an orientation to the building, we then go through all the different things that are available, and if participants are interested in joining the project, we sign them up through a terms of agreement, which is clear about both what we can offer but also what we would expect from participants in terms of their rights and responsibilities. And it's so important to us that people continue to have that voice throughout the programme as they progress, as their confidence grows, as their social engagement grows, as the activities and their skills grow from all the employability training they do as well. We want people to continue to have a voice on SAM, so participants are very active in everything we do, whether it be going along to present at an ITM unit event or being part of our user forum where we discuss the programme. It's all about participants knowing that they can talk to us about what they want on a one-to-one basis, on a group basis, and we work out how best we can meet their needs in an individual, tailored and bespoke way whilst offering the core aspects of the programme. To us here at SAM, we count progression in the wider sense. Positive progression for us can be anything from moving into volunteering through to training and education through to employability, and we're doing a lot of work at the moment on self-employment as well, because that's a route that can work particularly well for people we're working with. So to us, progression is in the wide sense, and again it all links to people having the confidence. So where they're upskilled, maybe starting with being on the radio might lead to the confidence to say, actually I can do this, so maybe I can do something on literacy and numeracy, or go to a CV writing workshop, or actually I can talk on the radio, so I can go and do interview skills technique training. It's all about people growing in confidence and constantly building. So where possible, we like people to have a personal development plan that they work through, and again through our partners we offer a lot of support, be it the Job Centre Plus coming in and working with people on a one-to-one, or our progression advisor coming in to really help people work out where they are in their journey, and when they've got that bit more confidence, where they can go next. The really interesting part of our journey has been where we conceived the model of SAM originally. It was very much about volunteers working in a mentoring capacity with service users, but actually it's much more fluid than that, because we're working with people who are living with mental health conditions and or unemployed. We found a lot of our volunteers are beginning to experience some of the sort of conditions of symptoms of mental health conditions such as anxiety, depression, sleeplessness, or they themselves might previously have been living with a mental health condition, and actually some of the stress, the difficulty of being unemployed has had an impact on them in the same way. So it's actually been really interesting to see how the model has shifted, because we realised of the value that what we offer, we can offer to volunteers and participants alike, whether it be increasing confidence, upskilling, learning new skills, moving towards the employment market. So really that's been a huge piece of learning for us on the programme.